someone confirm that they can see
Looks
my
great.
screen with the slide?
Yeah.
Okay, great. And then I'm assuming the black squares, people are sitting behind it, and so I'll go ahead and get started. Um, so hi everyone again, my name is Esther and clinical faculty in DOHS. Because I'm not a physician, I am very wary that the wording I use and the framing I use might not really land or might land very well in your world and your training, but do let me know when as you're listening and as you're thinking about it, if it's harder to make a connection or if you're not understanding something just because of the way I'm framing it is different, please let me know and we can apply them together. And so like this is kind of my disclaimer page, no financial any conflict of interest, but I did want to share with you the different lens that I bring to this lecture and to my role. And so I spend part of my time with the Northwest Pediatric Environmental Health Specialty Unit, which is Region 10 at PACU. We're a network across the nation and have pediatricians and environmental health specialists and toxicologists who primarily do consultation, education, and outreach around the different environmental health topics around reproductive and children's health. And so EPA and CDC funds my time there. And they, of course, don't endorse the contents of the slides because they've never seen it. And then part of my time I spend as a clinical basically instructor for the Department of Environmental and Occupational Health Sciences as for the Environmental Justice and Population Health course and some mentorship of students. And then I spend about half my time at Front and Centered, which is a coalition of frontline community organizations across Washington state, all across up and down the I-5 corridor, all the way east and west. And these are groups that are coming together. Each of them have diverse missions across, say, like civic engagement. Some do direct services, some are advocacy groups, some have a farm, like a co-op farm that they run, but all coming together and coalescing around environmental and climate justice priorities for the state and making their own space because historically there wasn't space for many of those groups. And so I work for them as the Director of Environmental Health Research and Partnerships. So I lead kind of the R&D program there and thinking about how do you incorporate and put community at the center of research of everything. And so if there isn't data, then well, let's start collecting data. If there is data that we already have, how do we think about it in a sense that is really equity centered? And so these kind of three experiences are what I kind of have embedded into the slides that you're going to be seeing and the lecture I'll be sharing. And again, feel free to ask away any questions. I'm going to set up my chat window so I can hopefully see it, but if not, feel free to unmute as well. And so I'll go over some of the definitions of environmental justice to ground us. Many of you would have heard it also in the lecture just now with David. You've heard elements of it. And then we'll look at some examples in addition to the ones that we saw around Cancer Alley at Flint, Michigan. And then I wanted to kind of present some cases and some additional facts for you to consider when you are thinking about patient interactions and some things that we can perhaps all do together or on your own. And so in defining environmental justice, it's really key to think about environmental racism because environmental racism has been a cause and such pervasive thing that's gone on, not in just in our country, but in the world. And it's really that longstanding precedence of excluding people of color from the leadership, power, privilege, and that, often include facing inadequate healthcare, access to healthy food, less political power. And this imbalance have perpetrated that racial discrimination in policymaking and regulatory enforcement. And it's really a deliberate and official sanctioning of the environmental threats within communities of color. You do that from way back when, it rolls up, it piles on, and now we see all the disparities that we do. And so environmental justice is that movement's response to environmental racism. That's how people are really framing it. It's like, well, what is environmental justice? We really take, the elements around us for granted, breathing air, water, and whatnot, until that right's kind of taken away from us, until, the water's dirty and the air is polluted. And then we realize, oh, we need to correct something, right? And so then the environmental justice movement is really that response and trying to correct for that disproportionate burden of environmental hazards on communities of color and low-income communities. And so there is no universal definition, although I think many of you kind of like have a feel for it. It's sometimes like a feeling. Somebody asks me, why isn't this an EJ thing? And it's a feeling, which is really hard to describe or measure. But the two most common elements that you will see is around that procedural justice. Who is involved in that decision making? Who gets to make those decisions? And then the decisions, who's being meaningfully involved instead of consultation. So like for tribes and tribal nations and government to government consultations, right? There's a whole process for that because they're striving to make sure that it's a balance and there are actual conversations happening rather than just simple, what do you think? And then moving on past just getting some comments in. Another big aspect, which we talked about a little bit around air pollution, is the distributive aspect. So that equal or the unequal distribution of that environmental burden on different communities. So air pollution, water, and later I'll talk about kind of the cumulative impacts of all of these together. And then that third element sometimes makes it into definition, sometimes doesn't around that regulatory or that corrective aspect. So what are we doing to kind of correct that? And where is the justice in that space? Oh, sorry, this something happened with the font. EPA's definition is the most prominent one you'll see because as the federal agency, this is the most common one. And it really focuses on the process aspect, the fair treatment and meaningful involvement of all people and what different places. And so, for example, for Washington State is doing, in addition to that process, Washington State explicitly acknowledges that disproportionate health impacts on communities and the need to address that. And so it's my own bolding here, but now you'll see different contexts in different places that some in their definition will outwardly address that distributive issues, others won't for many different reasons we won't go into today. And people describe it in different ways in different places. And I think in part that is the beauty of environmental justice and social justice, because justice means very different things to people, while the common goal is being equitable, being fair, having equity. It's a social movement. It really emphasizes, especially for the environmental part of the justice, is that who is bearing the greater burden, who's making the decision. And a lot of the principles or the definitions that are articulated today goes back to that principles of environmental justice that was articulated in 1991. It was a first National People of Color Environmental Leadership Summit in Washington, D.C., where over 1,000 people got together. It's one of kind of the first really big gatherings around. Let's think about and articulate what the principles of environmental justice is. And here you'll see some of the things that I mentioned that we all just take for granted until we realize it's either gone or not there. And so thinking about the sacredness of Mother Earth or the right to ethically have balanced and responsible uses of land and renewable resources, or the universal protection from things that threaten the fundamental right to clean air, land, water, and food, etc. It's actually more than just these not quite 8-6 that I bulleted that I was trying to pull from to kind of highlight what some of the things it encompasses and all really focusing on that right. And so it's hard to regulate a right, right? And so there has to be a lot of kind of the regulatory thresholds, or there'll be guidelines around the environmental regulatory space. But at the end of the day, really thinking about not just what is that health-based standard or that regulatory line that people are regulating on, but at the end of the day, why is there that pollution? Can we get down below that? Is somebody bearing the greater burden that perhaps shouldn't be? Is somebody benefiting off of somebody else's health or different communities? Like, what's the cost? And so these are kind of three simple, but perhaps sometimes overly simplified questions that we often think about in the environmental justice spaces. Who's benefiting by that decision? Who's deciding on that decision? And who bears the greater, or who bears the burden? Is it pretty much equal? Is it how is it distributed? Because oftentimes or in the past, it's always been very one-sided burden and the other benefits. And there have been very clear lines that had been drawn, which I'll show you, and many of you have heard of redlining, right? And so that would be one example. And so in the environmental justice space, I spend a lot of time thinking about the causes, the root causes of inequities, and that always gets me somehow to this like power wheel, like privilege and power wheel. And depending on where I sit, it actually like flips around, because sometimes as a clinical faculty, just by having the name of faculty, there's some benefits and power and privilege that come with that. When I go into spaces with other community organizations that are, working from 3 a.m. because they had to adapt their work schedule because of the wildfire impact, and I get to wake up at a normal time. I'm female, I'm a person of color. And so there are different places where I can step in and out. And so I often go kind of up and down this axis of that domination. And so it's, I think, really important to keep this in mind when you are thinking about just your personal self, and just reflect and be very intentional about how you carry yourself, because this really matters in decision-making places. And it really matters how you acknowledge that, and knowing that, you do have a privilege in some cases probably not. just understanding that I think makes a big difference. And so really thinking about that power, the ability to decide who gets access to resources or that capacity to directly influence the behavior of others or a course of events. And so I'm on a council for the state called the Environmental Justice Council, and there are like 16 people. And we carry this really heavily because it's, we do make recommendations to the state and to the governor's office and different state agencies on priorities around environmental justice and whatnot. But 16 people cannot represent, all the priorities and concerns for the entire state. So how do you use and utilize that power for the greatest maximum potential for environmental justice? And so power is not necessarily a bad thing, but it's just how are you aware of it, how are you using it, and how are you considering it in the context of where you're sitting at? Because again, if you go to a different country, that might immediately flip based on what your socioeconomic status is or what resources you have, et cetera. And so, with privilege being often that unearned access to the resource because it just comes with that social power or assumptions or appearance or the color of your skin. And so, we really always are very wary about, how do we know who has privilege or disadvantage? Again, society kind of sets it for us as kind of a norm. And so, in the environmental justice space, we're really thinking about, all right, well, how do we think about privilege as a privilege? Let's name it and let's figure out a way to make sure that that's not unequally burdening somebody else. And so I want to take us kind of back in history for Warren County, North Carolina. And this is viewed as or talked about as kind of the catalyst of the modern day environmental justice movement. Although that phrase doesn't acknowledge, all the hundreds of years of the struggles of and the pursuit of environmental justice by Indigenous people ever since the colonizers arrived. And this 1980s instance was where there was a lot of press, there was a lot of national attention to really thinking about what environmental justice is. And so we'll dig through that kind of together. And essentially, there is a landfill that had 81,000 tons of PCB contaminated soil buried in a landfill. And you all probably know much more about any of these health effects than I do, but really something that bioaccumulates, biomagnifies, you really don't want it around because it can volatilize into land and water. And up to 1979, for the Toxic Substances Control Act, people were using it. They were selling the byproducts from one place to another. And then all of a sudden it got banned because of their potential carcinogenicity. And then now people had to go through a bunch of different processes to get rid of it as hazardous waste. So as you might imagine, what some people might have done is they try to dump it, which is unfortunately what oftentimes still happens to this day. And so there was a group called Robert Burns. They dumped 30,000 gallons of PCB-laced oil along a 200-mile stretch of highway shoulder across 14 counties of North Carolina. They basically had them, slowly leaking and just drove it up and down with their family. And so now not only do you have like 30,000 gallons of PCB-laced oil in a tank, now they're in the soil. And so now it's doubled into 60,000 tons of PCB contaminated soil. And it took a little bit for people to figure out, oh, okay, well, this happened. Well, now what? And so the state of North Carolina was asked to think about where do you put this hazardous waste material that's now huge, massive amounts, and how do you dispose of it? And oftentimes it was, like hearing the stories of people. There was a project where folks were trying to gather that experience of people so it doesn't get buried by numbers. And so this was one where it really resonated with me. And there was a person that said, I feel like I was probably one of the first in this county to come into contact with that PCB dump. I was moving a piece of my equipment and I had a flat tire. And when I was actually changing that tire, it was still wet and to the point where it got all over me, but I had no clue what it was. And so if you can imagine that's PCBs all over you, you don't know what it is, and the potential health effects from that exposure, right? It might be a one-time exposure, but a ton of it compared to maybe small exposures for a longer period of time in an occupational setting. And so at that time, folks were thinking about, all right, well, how do you put this? The in-state burial of waste was approximated to be 2.5 million. So here's a little bit of thing that I'm always wary about because I think what moves people is often like healthcare, health damages. If you talk about it in like more mortality or number of asthma or emergency department utilization rate or money. And then, so it's really important to just be wary of what's going into that calculation because they don't always consider the true cost of what the damage is or on somebody's health. And so in this case, if you look at all the other options, either there was no cost estimated for, say, an in-state burial within each affected county to kind of spread out the hazardous waste, or transporting it back to the EPA. Incinerators, there's no cost estimated. And then at that time, there wasn't really a method for extracting the PCB and detoxing it or treating it at the site where the contamination is actually happening. So as you might guess, people said, well, let's go with the cheaper option. And if you think about, who's making the decision, it's mainly state of North Carolina with EPA that are not living in these communities that are predominantly Black. Warren County is predominantly Black. They had higher than state average rates of unemployment. They had many different issues and they struggled. So if you can imagine, if they had community open, listening sessions or public comment period, who has the time to go to those or talk about it, or who's able to even know about them? And so there was a lot of protests. Over, I think, 500 environmentalists, civic rights activists really got in. And even with that, they still moved that 6,000 ton truckloads of the PCB soil and material. And so ultimately, regardless of all that protest, it still happened. And then now that happened, of course, now it's because it was close to a water site and all of the leakage. Now I had to go through a remediation process. And so I'm curious from you all in the chat, just take a wild guess. How many years did it take to clean up that mess in 1982? Couple years, 5 years, 10 years, longer than 10 years. Oh, first person nailed it. 20 years later. So they said 20 years later, consider fully remediated, $17 million later, and think about how many lives and many other impacts that came from this. And even then, I think to this day, there are some conversations and I think some active monitoring going on to make sure that they really clean up, because it can really get everywhere. And that was a lot of contaminated soil. And so now thinking about the land use decision, or the decision to put the landfill in a certain area, it's not any new news. I'm sure many of you, if not all of you, have heard of, the saying of your zip code can be a better predictor or a very good predictor of your life expectancy. Or in some cases, I think I've heard like your genetic code is not as good as your zip code in predicting your life and health, which is not what we want to hear, right? Which is not what we really want to think about. But it really can be traced back to, I think, at least what we're in today is that redlining. It was like a government policy on that New Deal. Housing policy started in 1934. It did go on until 1968 and still has repercussions to this day. And the intent was to help Americans buy homes through federally backed loans, intended for, really encouraging the economy and et cetera. And through the appraisal of home value and neighborhood assessment, they were trying to really gauge this based on the safety and security. But essentially, the safety and security was really based on just who, people of color. Are there people of color living there, or is it predominantly white? And so this, what you see on the screen, is the redlining map of the greater Seattle area. And so it cuts off right here and there, so a little bit smaller than what we know now as Seattle. But think about kind of the areas you see as, more well-to-do, well-off. So like, for example, like Windermere's right here, more mixed use over here near University District. And then if you think about kind of the Duwamish Valley and all the different contamination and what's going on, they were actually coded as industrial business. So it's not even captured in the redlining map, because redlining people had to be there. So if there's people wanting to move in and there wasn't space, or the loan was not affordable, people started to move into the areas next to the redlining maps or in the industrial or business areas. And so that was the decision being made back then. And to this day, this actually really carries through. And so on the right side is what's the current environmental health disparities map of 2022. And I'll go over that method in a moment, but it really looks at the accumulation of risk for around pollution burden, around vulnerability, whether it's individual biological susceptibility to pollution and community vulnerability, like unemployment rates and other things. And like the places that were kind of red back then is kind of red now. And so the decisions that we make 100 years ago still has repercussions to this day. And actually, if you look at like the COVID-19 case rates, the map looks really similar. And of course, there's a ton of studies thinking about redlining and even wealth. Like, what did that do for really promoting white families and accumulating wealth since back then to now versus for other families that might not have been able to access homes, home loans, or had to pay egregious rates. And so there's continuing studies around, like the effects of redlining and gentrification, access to green space or blue space, air pollution, and life expectancy, and many others. And some of these are, a lot, like 14.7 years less in red line neighborhoods and in Minnesota, or like 1.3 years greater life if you're compared to a neighborhood in Utah. I'll show you an example for Washington State too for what we're looking at. And so when you think about the pollution burden on an individual or on a community, and when you think about what starts to pile all on, there have been more and more voices from communities saying we need an easy to communicate way to talk about this to decision makers, to different people that do have the power or the resources to be able to do something about it. And so what kind of came up in the last 10 years or so is these cumulative impact map. And so California kind of started one, US EPA federally has one, Washington State now has one. And it's a way to communicate the multiple cumulative impact or the multiple environmental hazards and how it weighs on a community. And of course, because there isn't a formula, right, that we know, oh, my air pollution was this much on this day and that my health outcome will be this. But for a community level, it's a really good way to kind of represent where the harms are. This is a harms approach, so we're very aware of that. This harms mapping is only one aspect. There are many assets and positive things going on in these communities too that will kind of counteract some of these negativity, but nevertheless, so right now, CDC actually has one that they created within the last 6 months, and it looks at environmental burden itself. So, for example, air pollution, proximity to toxic waste sites, built environment, transportation, infrastructure, water pollution, some of the things that you all named earlier, along with social vulnerability. What's the racial ethnic minority? Is there a lot of them, less of them? Socioeconomic status, housing type, and then you mix this in with the health vulnerability, the prevalence of asthma or cancer or high blood pressure, diabetes. And so ultimately, you end up with a ranking. And with this ranking, people are going to decide or think about, all right, where are the priorities when we're thinking about environmental justice as a whole, not just air pollution, but as a whole. Even if you are ultimately your program that thinks about air pollution and you might be trying to reduce the burden of air pollution, who's most burdened by all of these different factors for social health and environmental burdens? This is the model that Washington State uses. What are the threats or the pollution burden on communities? So here you'll see things that the air pollution, heavy a little bit, diesel emission, ozone, and PM 2.5, lead risk from housing being one of the really big exposures for children, right? And thinking about the contact they have, and proximity to different places around hazardous waste sites, Superfund sites, risk management plan facilities, or toxic releases from facilities. And in thinking about the effect modifier, we know that right with the effect modifier, it compounds your experience. And so that's why we actually multiply in Washington State and in California, multiply pollution burden score with the vulnerability scores, because we know that effect modifier is happening. So that socioeconomic factors you see on the screen is the community level vulnerability. So if your community has a lot of people or a more proportion of people with limited English, no high school diploma, more people of color, people living in poverty, all of these things, your exposure experience is probably going to be worse, but not probably, it's known to be worse because of all the different barriers that would get in the way. People with high rates of cardiovascular disease, or people born with low birth weight, or people with asthma, which is not an indicator yet, it's coming. If you have those illnesses, then if you're exposed to the same amount of air pollution, your experience is going to be much worse, right? That you might feel the impact sooner, it might be worse, it's going to exacerbate your current conditions. And so that's what goes into that vulnerability bucket. And ultimately, it spits out a risk score and saying, well, you're highly impacted or less impacted. And it's a relative thing because justice is a relative thing, right? And so when you look at that and look at the data, the life expectancy, so right here is the average of 80.3 for Washington State. And this is for the ones or the least impacted groups, census tracts in Washington State. And then the 10s are the most impacted by all the different indicators that I just talked about. there's a pattern, right? There's a big pattern, and this is something that we, I think, in the long run, don't want to be working towards. We want to try and level it out. We want everybody to have improved lives, but what's the rate of really bringing this community, the ranks nines and the tens, up so that their life isn't being sacrificed by being in a sacrifice zone or being in a community that's being overburdened. And this connects to that climate change space, right? The climate related risks are not distributed equally. We know that. We know that climate change is really worsening existing disparities, and people that are feeling the effects, for example, from wildfire smoke. Um, Communities that have struggled might struggle more. Like, who has the resources to go get an air conditioner or a HEPA filter and have it in your bedroom, and the electricity bill that goes up, right? There's a lot of different aspects that really come into it that further compound it. And then especially in terms of climate change, the harms associated with it, the burden's greater for the groups that are less responsible for it, like the United States being, as a nation, huge culprit in the greenhouse gases that we emitted. And yet we probably as a whole experience a little bit less than some of the other countries that are actually dealing with more of the impacts, like some of the Pacific Islands and whatnot, that are actually losing their country because it's now being submerged under the rising sea levels. And so even thinking about climate justice, there's this model of what's the exposure that's happening of the hazard specific, the climate related hazard, what's the sensitivity within that community that would make them more sensitive to when they're exposed, and what's people's ability to adapt. And that's where a lot of that community level factors come in, right? Who can relocate your town, who has the resources to just sell your house and buy it somewhere else because you're currently under a flood zone, or who can afford flood insurance. And then so all that adding onto the climate vulnerability that does really, end up in health outcomes that are really measurable that you all see in your clinics, like injury, heat related illness, respiratory disease, et cetera. And as you see in a map earlier, there are many maps. I'm a mapper, by the way, hence a lot of maps here. Wildfire vulnerability, flood vulnerability, heat vulnerability, all of these, a lot of the areas are areas that we know because they have certain built environment conditions. For example, less tree canopy, higher poverty, maybe more outdoor workers, and then your heat vulnerability will go much, much more higher. And so think about when you're thinking about environmental justice in the setting of your clinical practice, what's that accumulation of risk? And don't only think about this from an individual perspective of what's the risk A on top of B on top of C, but for a community level as well. Within that community, what are the resources they have? What's the healthcare access? And I'll go into an example or a case in a moment. Thinking about high blood pressure, like maybe there is inadequate nutrition at an early age, or maybe access to food, if there's a food desert, and there's childhood obesity now. And so in addition to all of these things, it really accumulates to that disease onset, both for individuals, but also broadly when you're looking at the community's health. And so this, I really like looking at this because in my world of environmental justice mapping, and also thinking about what are some research aspects we can look to try to correct it, a lot of what we do really crosses these boundaries from like broad societal, institutional, to kind of the socioeconomic policies, down to like local communities, down to interpersonal relationships, down to individual behaviors and individual relationships too. And so this is a diagram I really like to look at a lot because it's like, where am I working at? Because I want to know exactly where I am. Otherwise, I get lost. And so really think about, incorporating precautionary principles, which all of you have heard, is, thinking about what, in terms of uncertainty, let's be more cautious. Let's make sure that we're not saying, keep polluting until we know there's a harm. Maybe think about, all right, let's find out more of what the issue is before we say yes to maybe adding a certain pollutant into someone's neighborhood, um, or to somebody's workplace, et cetera. And so really thinking about, in the face of uncertainty, because many of what we do, we don't have a crystal ball, we don't know what the future is going to hold, think about the preventative action. And so that's where that public health lens comes in, and that training is, what can you do more upstream to try to prevent some of these from happening? Let's shift that burden of proof not to the community that has the impact or the individual that's having the impact, but what can you push more towards those that are responsible for maybe those pollutions? Let's explore the alternatives to possible harmful actions. And so that's where you start to get to kind of that triangle for the engineering control versus administrative, et cetera. And then this last part, which is really difficult to do, but also really fun to do because everybody can, I think, do in different capacities is really thinking about increasing the participation in decision-making spaces. So it is really equitable or make space for those that aren't there because they couldn't be there. And so I just wanted to share kind of two different scenarios, and these are actually based on real scenarios that had happened. So, this one you saw a similar case of middle-aged worker, ongoing tobacco use, a COPD, presents with shortness of breath, cough, wheezing, and it's been worsening. And turns out this patient actually lives near the Duwamish River, where a few days ago a barge full of scrap metal caught on fire. And so in the discussion, in the chat, or feel free to unmute, like what are some questions that come to mind if you kind of see this as a snapshot? Is this pretty common in your clinics? What types of questions might you ask? Maybe this patient comes in and the next row another patient comes in that also has asthma and has also lives near the Duwamish River. Yeah, what are some of the PPEs or what are some abilities to be able to control that, control the disease? Anybody actually familiar with the area? Like this sounds familiar. It actually happens all the time, which is actually the case in this case. And so what's been happening in the Duwamish River is, and it's been a known issue, is there's a lot of metal recyclers. There's a lot of things that they do that are, hazardous. And so it has caused many harms in the community, along with like polluting the river, but also having these, fire and these air pollution instances where it actually now has a direct impact on the community. What would be ideal is, all right, if there is if there is an incident, maybe there's a way to really notify or really get to these workplaces where people might be exposed because they're working outdoors with no mask. Um, but none of these notification processes are really built into a lot of the things that we do. And so it's only after the fact where people go, oh, you felt that too, me too, I was at the clinic. And so then people start to realize, oh, it wasn't just me having a bad day with my symptoms. There was actually something else in the environment that's really impacting me. And so really, I think be wary of, the community where they're coming from, because sometimes these actually might matter in creating solutions. One of the work that I'm doing with my community organization is building a reporting platform so that, well, maybe we can start collecting our data. So if there are chronic issues of known environmental instances, or what do you call it, reporting, like sometimes criminal violations, sometimes like not criminal, but still violations that are actually can be investigated on. So let's build our own database so that communities feel and know it's kind of crowdsourcing our information. And so then that could be a tool that folks are using to think about, oh, okay, I had this, I had been constantly having this. Turns out there's been fires going on constantly throughout the week and whatnot. A different example here, there is a patient with disease with the artery and collapse at the end of their workday shift. And it turns out that that was the day that the National Weather Service had a heat advisory of 101, working in the hops field. And so some of the questions that comes to my mind, because this is also based on a true story, this person actually passed. And the coroner actually noted that environmental conditions were a contributing factor. But thinking about farm workers, right? Who has access to healthcare, in what setting, how are they working, what is their access to PPE, can they afford their own PPE if the employer doesn't provide it, does the employer provide it, what were the guidance and trainings, what were some of the ways where, like, were they allowed to take breaks, were there enough places to take breaks, um, were there good sufficient places to actually seek refuge, especially for the hops field, right? That can really trap a lot of the heat and really actually make it even hotter out in the field. And so this actually was one of the cases that brought on that emergency wildfire rulemaking process that David mentioned earlier, because this isn't the only example. This actually happens quite often, especially in our summers up here, with the more frequent wildfires up in Skagit and Whatcom County and Yakima. And so I do want to kind of take a pause right here and think about, environmental justice. When we talk about it, we often talk about it in the injustices. And so it is really heavy on the heart. And so I think it's always really important to think about, celebrating the fun and the victory. And there's so much art. There's a social justice film festival. There are many things where people are celebrating and working really hard towards it. And so I really encourage you, as you're thinking about it, it is a heavy topic. Inequities are really hard to see and to observe, and especially at the point where they are showing a health symptom or issue, it might feel very, yeah, difficult. So always feel free to kind of reach out if you want to talk, or just yeah, plug into places where you can kind of celebrate some of the positive things that are going on with the space, because it can be hard. So what can you do as individual physicians? What can you also do if as an individual? And so I wanted to share an example that I'm hoping will kind of challenge some of your assumptions. So always be willing to unlearn to really learn. And so green space is really big with an environmental field, built environment. We talk about it all the time, right? Like if you can access your local park in between your shifts, or if you can take your family out, it really reduces air pollution, promotes mental health, physical activity. We know these positive things, right? They're good for you, basically. There can't be any harm. And so this is a true story. City of Detroit wanted to really reforest streets to bring back a lot of these green spaces to communities. And so they partnered with a Greening Up Detroit partner to plant 1,000 to 5,000 new trees per year. And a quarter of the residents actually said no thanks. And so there was a university that stepped in and said, like, why wouldn't you say yes? This is all it is good for you. There's all these health benefits and all of that. And people still said, like, yeah, we know, we still don't want them. And so in doing this conversation and this evaluation that University of Vermont did, they found out that it's not actually the benefits that people were ignorant to. So it wasn't about the education and the training. It was that how the tree planters presented themselves. They weren't from the community. They didn't know the community. It was a predominantly Black community, but these volunteers that were going in are predominantly white from not from Detroit, and they were going in and saying, like, well, why wouldn't you accept it? And so it was that mannerism and the way that they were really presenting this opportunity. And there was a lot of distrust in city government around trees, because back in 1960s, during when there was a lot of unrest due to civil rights, a lot of trees went down. And so the official city word was that there was a Dutch elms disease that really took down the trees. And they were trying to, spray DDT. And so the helicopters would fly over and try to manage the everything else going on. But to the community, that was city was cutting down trees not because of disease, but to monitor our community. And the helicopters are going around to try and find us. And so because of that, people really didn't trust the city government. And with the experience with the trees, so people were saying no thanks to that. And so through this experience and actually just reading about it too, because I was initially very surprised that people said no, it made me really think about, all right, like never assume, because you don't know why someone's saying no, or you don't know why someone might be hesitant to think about like a health promoting behavior or trying out this other treatment or something like that, because we just don't know. We just don't know why they're saying that and what trust had been breached up to that point, because environmental injustices have gone very far and deep in our history. And then two, which is a common theme that I think you're hearing, throughout today, is like, think about ways that you personally can advocate, or also in the different spaces, because you already advocate for good health and health promoting measures in your profession. I just wanted to give you two examples of different groups. Working with PACE, I have more contacts with pediatricians. So like Pediatricians for Climate Action, they think about, what are some levers that you can pull as a physician to really influence like policy change and trickling it down, but thinking about the social determinants of health and the broader determinants of health moving more upstream, and to think about influence the healthcare system. And so this is one example of things that they do. I think this might be Washington specific, but there are other, statewide groups. And then another one that actually writes reports quite often around the different issues and what the role of physician is, or what some of the angles that the physicians bring in, is the Washington Physicians for Social Responsibility, is another group that are really outspoken about some of the inequities around poverty and health and how that adds up and is being worsened by climate change. And so making that connection, they actually do a lot around, thinking about and really writing public comments and doing all sorts of things. And so think about, what are some ways that you might feel comfortable in. Some people might not feel comfortable being in the public setting, and some people might be. And you might plug into a different groups, especially that are very local, because change happens at a local level, even if it's global. And so I really encourage you to, think about different ways to incorporate not environmental justice just into just a clinical practice in the setting, but really thinking about what are some other ways that you can really kind of push the envelope for for challenging assumptions, for thinking about a better way to do things, and incorporating some of that principles of environmental justice. So I'll stop here and open it up for questions.
Maybe people need a few minute break. Oh, yeah, I see.
Hi, David.
Maybe we take a couple minute break and then we can come back and we can do a little bit of Q&A, and hopeful that maybe Cora could tell us a little bit more about the occupational environmental health clinic and other experience there, and what we might think about for our patients when that could be a useful resource for them.
Sounds great. Let's plan to resume on the hour, 11.